Distinguished delegates, Mr. President, we, the international community, come to this meeting in order to make a difference, not just to talk, but not just to negotiate a text, not simply to describe a problem that affects 33 million of our brothers and sisters around the world. And despite our progress, a figure still growing by 7,000 a day, 3,000 of whom are young people, 1,000 of whom each day are babies, the most innocent of the innocents. No, our purpose here today is to make a difference. That's why when we gathered here at the Millennium Summit, we resolved in the 6th of the Millennium Development Goals to halt and begin to reverse the spread of HIV by 2015. That's why, for example, we resolved in MDG 4 and 5 to substantially reduce maternal and infant mortality by 2015. And that's why we had the audacity a decade ago to embrace the MDG goals overall, to reduce poverty by 1/2 for the 1.4 billion members of the human family now living in grinding, degrading poverty across our world. Mr. President, Australia fully embraces the MDGs. That's why over the last 3 years we've increased our ODA by 50%. That's why we are on track to reach our target of 0.5% of GNI by 2015. And that's why we have one of the fastest growing ODA budgets in the world, this year standing at US $5 billion, despite the impact of the global financial crisis. And that's why by 2015 we aim to be among the top 10 ODA providers in the world. In 2015 we will all be held account on where we have succeeded and where we have fallen short against our solemn millennium commitments, one of which is HIV/AIDS. Figures tell the story, faces do as well. Let's start with the figures. Over the last 30 years, 30 million have died of HIV/AIDS. 33 million are living with HIV today. Antiretroviral treatment is now available to 6 million, resulting in a 20% reduction in the AIDS death rate over the last 5 years. 16 million children have been orphaned by AIDS. And in 2009, 370,000 infants were estimated to have been affected by HIV, notwithstanding the significant reduction in mother-to-infant transmission. These figures are stark. They contain real elements of hope, if in fact we build on them. But they also point to the dimensions of the challenge that lies before us. It is often at this point that people throw up their hands in the air in absolute despair. Yes, the challenge is great, but we should also ask ourselves the counterfactual. What if for the last 10 years we had done nothing? Nothing on prevention, nothing on antiretrovirals and their price-effective distribution across the world, nothing on research, where so many breakthroughs have in fact occurred. The HIV/AIDS challenge would have become an apocalypse, but for the actions of the international community, harnessed by the political deliberations of this great assembly. HIV/AIDS is not just about figures. It's about faces, human faces, across the length and breadth of the human family. HIV/AIDS is no respecter of persons. It is no respecter of nations. It is no respecter of gender. It is no respecter of age. It is no respecter of sexuality. It is a challenge for us all, and we must rise to that challenge together, or else we will fail. HIV/AIDS particularly affects the poor, which is why we see its greatest impact in the countries of Africa, but also elsewhere in the world. Over the decade since the first declaration in 2001, Australia has invested $1 billion on HIV/AIDS programs worldwide. Australia has also increased by 55% its commitment to the Global Fund for HIV and AIDS, tuberculosis and malaria to $210 million for 11-12. Australia's global HIV/AIDS programs this year is $172 million, focusing on PNG, Indonesia, Vietnam, Cambodia, Laos, Burma, the Philippines, the South Pacific, as well as across Africa. This annual figure will now grow significantly in the years that follow. Our single largest program, of course, is with our closest neighbour, Papua New Guinea, where infection rates are high. Our investment in PNG amounts to $183 million over the 5 years to 2013. And here in PNG, as elsewhere in our global programs, we intend to focus on infants with HIV who somehow have slipped through the cracks in many of our global efforts. The tragedy is that without appropriate care and treatment, more than 50% of newly infected infants die before their second birthday. And I repeat, 370,000 babies are born each year with HIV. This is a terrible figure. That's why I've begun to work with the Clinton Initiative in Papua New Guinea. HIV infection rates in PNG are higher than elsewhere in the Pacific. And in PNG, the challenges are real. We began working with the Clinton Initiative just a few years back. And back in 2006, there was no testing available for infants under 18 months. Then the initiative began and dried blood spot testing was introduced. Dedicated medication for infants and children became available, and health workers were trained in paediatric care. The difference this has made is marked. Take the town of Goroka in the Eastern Highlands. If we were to go to Goroka, we'd find that the death rate of young children with HIV has fallen dramatically in the past few years from 95% in late 2006 to just 6% in 2010. This is because of the efforts we have dedicated to this program. This is a good news story. Australia is proud to be part of it. I'm also pleased to say that we've set aside a further $11 million to extend this program in Papua New Guinea now for the next 2 years. That makes $25 million since 2006. That is why Australia wholeheartedly endorses this declaration's commitment to virtually eliminate all infections in newborn children by 2015. This is an ambitious goal. We in Australia intend to play our part. And, together with the rest of the international community, we can make a substantial difference. Distinguished delegates, to conclude, we have come to this conference to make a difference. This declaration seeks to do just that. It commits us to new targets. It recognises those groups who are the most vulnerable: women, girls and infants, men who have sex with men, those dependent on drugs, those most marginalised and stigmatised in our community. It recognises the need for parallel efforts in prevention, in treatment and research. It calls on all of us to meet the resources gap if we are to turn round the reality we still confront today, that new infections continue to outpace the availability of treatment. But all these things will fail if member states, in partnership with civil society, fail to act. Global declarations are not worth the paper they are written on unless they galvanise us into action. 10 years ago, at the beginning of my political career, I visited an Anglican school at Mashonaland East in southern Zimbabwe. There were 600 kids in the school, bright, shining, smiling, faces celebrating the universal rights of childhood. As I spoke to the headmaster, he told me that 1/3 of them were AIDS orphans. A decade later, I still remember their faces.
Mr. Minister,
let us resolve for these children and for others affected by this disease that we will make a difference. Australia is ready to play its part, and we seek to do so with the rest of the world. I thank the representatives of civil society here for their work. I thank delegates for their work. I thank also the global medical research professions for their invaluable work. I thank the co-chairs of this conference, the distinguished permanent representative of Botswana, and my own permanent representative, Ambassador Quinlan of Australia. Now let the work in the field begin once again, so that by 2015 we can work and report to the world that we have in fact made a difference.
Je remercie le ministre.